Hi, everyone. So my presentation today is going to be about a hemorrhagic stroke. My patient is a 48-year-old male who worked at a Spectrum warehouse. He experienced a left hemorrhagic stroke on January 15th, 2023. He has right upper extremity and lower extremity hemiparesis, and he requires a right AFO and a left narrow base quad cane. He lives alone in a single-story home and is mostly independent. However, his brother does take him to his major doctor appointments because he does tend to be forgetful. He is able to perform self-care independently without help, but he does have his brother come over to the house when he has to shower just for peace of mind for both my patient and the brother, just to make sure he doesn't fall in the shower. So I wanted to go over what my patient is experiencing. So he does have major toning in his right upper extremity, in his biceps and his wrist flexors, more so than his right lower extremity and his quads and calves. The toning limits his function during gait because of the decorticate. Also, in his gait analysis, he does have a pretty good circumduction in the right lower extremity due to the reduction of the hip flexion and knee flexion. He also lacks full knee extension at heel strike and lacks proper toe off at terminal stance. And during the neuroscreen, he does have clonus with his right patellar tendons and biceps tendon reflex. So a hemorrhagic stroke is caused by a cerebral blood vessel that ruptures within the brain or around the brain, and it bleeds into the surrounding tissues, it damages the brain tissue, and it disrupts normal brain function. The prevalence of this stroke is about 10 to 20% of strokes, and unfortunately, it is the most deadly and increases the long term of disability. And the patient population with this type of stroke, it's usually due to uncontrolled hypertension because long-term hypertension weakens the blood vessels within the brain, which increases the chance of a rupture. And also age is a pretty big reason because as we age, the risk increases, and with age, deterioration of our blood vessel walls, our blood vessels, just our whole body essentially just deteriorate. The poor diet and exercise just contributes to cardiovascular risks. Non-modifiable risk factors would be age, gender, race, ethnicity, family history. The primary system involved with a stroke is the central nervous system. The normal brain anatomy, we have the cerebellum, the cerebrum, the brainstem, and it is supplied by neurons, blood vessels, including the circle of Willis and cerebral arteries and even veins. The normal brain physiology would be that neurons rely on constant perfusion to function. So essentially what this means is that the brain cells, aka the neurons, they rely on constant blood flow to stay alive. The blood brings the brain oxygen and nutrients that it needs to survive and work. If the blood stops flowing, like during a stroke, the neurons can't work. And so constant perfusion, like a steady blood flow, is essential for the brain to survive and work properly. Autoregulation maintains steady blood flow despite fluctuations in the systemic blood pressure, which basically means the cerebral autoregulation is the brain's way of regulating the pressure and adjusts the size of the blood vessels. So even our brain is doing that as well. Physiology of a hemorrhagic stroke. It occurs again when a blood vessel ruptures within the brain, causing intracranial pressure. It leads to disruption of the blood-brain barrier. It leads to edema and compression on brain structures, reduction in the cerebral perfusion, also known as the blood flow. The pressure leads to ischemia and neuronal death. Increase the intracranial pressure and brain herniation. So the blood accumulation increases pressure around the brain, and our brain is within our skull. So if the pressure is increasing, it's going to push on our skull and it has nowhere else to go, and it essentially damages the brain. So again, the compression surrounding the tissues and blood vessels and the ventricles, and this can lead to a herniation syndrome. And the herniation syndrome is, again, the brain swelling and it has nowhere to go. It's pushed and squeezed from its normal position inside the skull. And the functional impact: decreased consciousness, abnormal posturing, respiratory irregularities, and potential death if untreated. The next function in affected brain region. The bleeding damages brain tissue directly and disrupts local neural circuits. And it depends on the area, the location of where this rupture had happened. If it's in the motor cortex, it can lead to hemiparesis or paralysis on the contralateral side. And like I said, this was a left hemorrhagic stroke, and everything he's experiencing motorly is on his right side. It can also affect your speech area, like the Broca's or Wernicke's area, which leads to aphasia. If the cerebellum was affected, this would increase the loss of balance or coordination. And the functional impacts this would have on the body is balance, impaired movement, speech, even cognitive functions. Is severe headache, which is what my patient experienced. He said that it was the worst headache of his life. Like, it was so bad. Nausea and vomiting would be due to the changes in blood pressure, loss of consciousness or altered mental status, elevated blood pressure, and focal neurological deficits, which is when it affects one side of the brain, like we discussed on the previous slide. So my patient's ability to participate in daily activities is affected by the restriction of mobility and physical function, cognition, communication, and ADLs. Physical therapy can address these issues with gait training, balance and coordination training, stair negotiation tactics, also task-specific training as well. The tests and measures that were performed in the evaluation were passive range of motion, neuro screens, coordination, muscle length, manual muscle testing, and OGA, observational gait analysis. And the PT's prognosis is poor due to the time since onset. When he started at the clinic that I'm at now, he started in January of this year, but he had experienced the stroke 2 years prior to that. He was doing physical therapy at first somewhere else, and then his insurance lapsed. So he had a break in therapy, and so his prognosis isn't very well due to that. The interventions that would be performed for acute phase would be low intensity rehabs. You don't want to do too much to the patient. They just had a traumatic experience. So we would want to do passive range of motion, active assisted range of motion. We would want to teach them bed transfers, breathing exercises, cognitive screening, sensory screening. But we also want to make sure that we do early mobilization as much as possible, just to get those muscles working again and get that brain to body neuroplasticity back again, okay? So we would want to do eating, instructional training, also education for the caregivers and family members because their life is going to change so much and they are going to need all the help that they can get and all the support that they can get. Interventions for the subacute phase include task-specific training, sit to stands, gait training, reaching, just trying to get them back into doing things that they did before they had the stroke. Interventions for the chronic phase would include gait training again, coordination, speech therapy, strength training, neuromuscular reeducation for neuroplasticity, and also fall prevention. Flexion and extension for the right lower extremity. Also passive range of motion for the right wrist and elbow to work on the toning because it was so locked. It was crazy. So we would really work on wrist extension and elbow extension, and it was pretty hard to get him to extend because his body was so used to being in that decorticate state. We would also do passive range of motion external rotation. He would perform squats and also tandem stance. He did cone step up with his right lower extremity with finger assist on the parallel bars. He would also do a stair negotiation with a 6-inch step, and we would put a hemi walker on the right side of him just to get him to stop compensating for that circumduction. It really helped him focus on working in that straight line. And if I was ever presented with another case like this, I would be excited just to work with them because there were a lot of stroke patients at my clinic, and they all just seemed to want to get better and try to get back to life as normal as possible. And a lot of them did have hope. So their motivation motivated me to help them as well. And if I was presented with another person in this way, I would give them my full attention. I would listen with empathy. I would want to motivate them and set realistic goals that are achievable. I would ask them what their goals are just to aim at their prior level of function. Due to his level of restrictions, all interventions were achievable at the clinic that I was at. However, their treadmill wasn't working, but he was able to ambulate around the clinic. He basically used his cane just in community areas, if he's going out to eat or any of that, but if he's at home, he doesn't really use it. And he's more of the chronic phase anyway, so if he was more acute, I think a Hoyer lift would definitely be necessary, but there was really no acute stroke patients at the clinic. He did have access to transportation through Medi-Cal, and there was plenty of research and literature to help me with this condition, especially in the O'Sullivan's book, so that was really helpful. And for my last slide, I just wanted to remind everybody what to look for in case somebody was to have a stroke or if you were to have a stroke. Always have them smile. If one side of their face is drooping, that's a sign. If you have them raise their arms and one side starts to drop, that's a sign as well. Also, if their speech is slurred, and also time is of the essence. You got to act as quickly as possible. All right, I hope you enjoyed my presentation. I really enjoyed working with my patient. He was amazing. He always said, I just hope one day I wake up and this is all gone. And it really tugs at your heartstrings a lot. So I hope you enjoyed. Thank you.